The first step is with high vaccination rates. You'll know that we're being resistant to setting a target. We didn't want to leave anyone behind, and we still don't. But we need to give everyone, and especially Aucklanders, certainty over when it will be safe enough to transition to a new system, one where we can give more freedoms to those who are vaccinated. We've looked at all of the evidence, talked to experts, looked at modelling for our situation, and set a target of 90% fully vaccinated for each DHB in New Zealand. The reason we're focused on each DHB is because we need every region to be highly vaccinated. And by focusing on DHBs, we also make sure we get more equitable outcomes. And when every DHB reaches this target, that is when we'll move into a new framework called the COVID-19 Protection Framework. Let me tell you how this new system will work. Similar to our current alert level system, there'll be 3 settings: green, orange, and red. They're designed to help us manage outbreaks and cases. While you could have cases in the community at any of the different settings, we can use them to try and get numbers down if they're affecting people's safety and our health system. There are 3 big differences between this new system and our current one. The first is that it uses vaccine certificates. Basically, if you want to be guaranteed that no matter the setting that we are in, that you can go to bars, restaurants, and close proximity businesses like a hairdresser, you will need to be vaccinated. The second difference is that with vaccine certificates at red, orange, and green, businesses will be able to continue to open and operate. This, I know, is the certainty that many have been looking for. And the third major difference is that rather than use general nationwide lockdowns, if we have cases that start to climb and in areas where we have lower vaccination rates and vulnerable communities, we can use more highly targeted and very localised lockdowns if we need to. Let me give you then a very quick run-through of each of the settings. The red setting is what we use when the virus is spreading in a way that means we need to take action to protect our most vulnerable and prevent too much pressure on our health system. So here, while hospitality is open with vaccine certificates and retail is also open with the usual public health measures, gathering limits and physical distancing will also be required. Education will be open, but with public health measures in place. Working from home is encouraged. Masks will also be required in the same way we use them now. This will still feel like a huge amount of freedom relative to what Auckland has now. And because they have done so much work to lift their vaccination rates, and because of the border around the city, rather than wait for the rest of New Zealand, Auckland will move into red as soon as all 3 of the Auckland DHBs hit the 90% double vaccination target. To everyone in Auckland, our businesses, people on their own, families with young children, everyone, I know this period has been so hard, but you are so close. Right now, you're just 16,000 vaccines away from every DHB hitting the 90% target for first doses. When that turns into double doses, that's when this new framework kicks in for you. And I know that vaccination certificates will help us get those numbers up. For the rest of the country, once every DHB hits 90% double vaccinated, we anticipated we will move collectively together to orange. At orange, everyone remains open, but because of vaccine certificates, all of the gathering limits currently in place for events, gatherings or hospitality, they can lift. Places that choose not to use vaccination certificates will either be closed or will have public health measures in place. Green is when there is some COVID in the community, but at low levels. Fully vaccinated people can enjoy all events and hospitality and gatherings by showing a vaccine certificate. Where premises choose not to use vaccine certificates, they will face restrictions on numbers and spacing similar to the current alert level framework. Face masks will only be mandatory on flights, but will be encouraged in indoor settings. There is quite a bit more detail for each of these settings, but they will feel familiar. We've based them on what we have learned from using our old alert levels. But the reason we have changed from this system is because we needed one that could make use of the new tool of vaccines and vaccine certificates, a way that we could keep vaccinated people safe from those who have not been. Vaccinations are our armour. They help keep us safe. So my message to New Zealanders who have not yet had their first dose: if you want summer, if you want to go to bars and restaurants, get vaccinated. If you want to get a haircut, get vaccinated. If you want to go to a concert or a festival, get vaccinated. If you want to go to a gym or a sports event, get vaccinated. If you are not vaccinated, there will be everyday things you will miss out on. And if you are vaccinated, you can be assured that in the new framework, you will get to enjoy the things you love, secure in the knowledge that the people around you and the environment you are in is as safe as possible in a COVID world. If you've done the right thing to keep yourself and others safe, to look after one another, you should feel safe. You should be protected from those who haven't made that choice. That's what the protection framework seeks to offer vaccinated New Zealanders.
One of the issues that we are working through is what to do in terms of businesses who decide not to be part of the vaccine certificate regime. If we use the current settings based on revenue drops, we may well end up supporting them, but not those who are using certificates. It is my personal preference that any payment will not be made available to those businesses that should be operating using a vaccine certificate regime but choose not to. However, this requires further work to be operational.